Hello everyone, welcome to my channel. My name is Shalom, a woman who wears many hats, but today I'll be chatting to you in my capacity as a mom and a hypnobirthing childbirth educator. So today we will be chatting about the how and where of birth. The first thing that a lot of people think about once they find out they are pregnant, after all the initial feelings of excitement, anxiety, whatever you may be feeling, is how you will give birth. It's important for you to know that the decision on how to give birth lies with you. I also would like to just encourage you to be the advocate for your own birth and your baby's birth. As a parent, you know what's right for you, you know what's right for your baby, and trust that gut feeling. This is only for informational purposes. I really encourage you to go out there and do your own research as well. Let this be the baseline if need be, for you to learn more, for you to learn about birth, but also go and Google a bit, find out about different things in your area. Anyway, with that being said, let's get straight into the video. So there are two different methods of giving birth. The first one being a C-section, which is also known as a cesarean section, or as I like to call it, a belly birth, because I find belly birth is it's a much better name for it. C-section or cesarean section can be quite clinical. With that being said, there are two different C-sections available. There's either the elective C-section or the emergency C-section. Now what happens is with an elective C-section, a woman will decide from early on in her pregnancy that she wants to do a C-section. She'll go to her gynae or her OB, obstetrician, and she'll say, okay doc, I would love to have a C-section, can we please set my date? Or the doctor will say, yeah sure, let's set your date, and then she then chooses. The other thing that might happen, which isn't normally spoken about, is that the doctor kind of encourages or persuades the mom or the parents to rather go for an elective for whatever reasons that I'll speak about in another video. But for example, they'll say your pelvis is too small, or they'll say, you know, there are a plethora of reasons why they would tell you to rather get an elective C-section, but that is basically the decision that the parents make to go and have a C-section or go and have a belly birth. And this is basically surgical birth, where they literally cut your abdomen open to pull the baby out, right? And you'll go to theater. The great thing about it is that you are, sorted, you know which date you're going to give birth and that sort of thing. And then that is basically the C-section. Okay, with regards to a C-section, we have the elective, and then on the other hand, we also have the emergency C-section. So generally what happens is perhaps you've already started labor, you were meaning to have a natural or vaginal delivery, and along the way there were complications. So what will generally happen is your obstetrician will decide, okay, or your gynae will decide, okay, this person, it seems like labor isn't progressing as we would have liked, so we want to take this person into theater for her C-section so that we don't risk her life, mom's life, or the baby's life. So that's a decision that can be made as well. It's important to remember that you also need to be considered in this decision as a parent. It's important to advocate for yourself, and it's also important to know at which point you have to go in for an emergency C-section. You must know this information. No one else will advocate for you unless you advocate for yourself first. Okay, and the next one is a natural birth. So with natural birth, in the medical fraternity, it's also known as vaginal delivery, which is a very clinical name once again. But with natural birth, what generally happens is you go wherever you're going to be giving birth, and you basically allow birth to happen by itself. So you'll go through labor, and at the end of that labor process, you would then pop out a baby. It's not as easy as just popping out a baby, but we'll go with that term for now. And basically what will happen in terms of the natural birth is you'll either have an assisted natural birth or an unassisted natural birth. Now, assisted generally means that you will either, the doctor will either use a vacuum or forceps to help you give birth, or in terms of unassisted, it just means that you push the baby out using your body. All right, and then there's also other terms which are important when it comes to natural birth, and those terms are things like unmedicated, which will generally mean that things like an epidural, any kind of medication is avoided, and that's it's important to know that as a parent, because you need to make decisions as to how you would like your baby to be born. I just also want to remind you that birth is something that a woman remembers forever, regardless of whether she's just given birth or she's 70 years old and she's, welcoming the birth of her seventh grandchild, for example. So it's really important that you make a decision that aligns with your values, make a decision that aligns with your body and your health, and a decision that you will be comfortable with at the end of the day. It's also very important to take the medical advice of medical practitioners into account, because obviously they went to school for this, so they know better, but they also are taught to treat pregnant women more as patients rather than as parents. So remember this. As I said earlier, please do your own research, and please make sure that the decision you make is the right decision for you. There's no universal right decision. We know that there is an ongoing debate over which one is right. Is a C-section right, or is a a natural birth right? But yeah, so it's very important for you to remember that it's not about what's right, it's about what's right for you. Okay, and now we can chat about the way of birth. So there are generally two branches. It's either you go the government way or the private way, and each of those has its own kind of little branches underneath that. So with regards to government, just a reminder before I continue that this is another decision you have to make for yourself based on your own circumstance. So based on whether or not you have medical aid, based on whether or not you have the means, based on various factors, things like does the birthing facility treat you in a respectable manner? Do they, you just have to kind of trust your gut when it comes to this thing, as well, when it comes to birth, as well as doing your research. It's important. Research is so important when it comes to having the kind of birth that you envision for yourself, because you also can't envision something you don't know. All right, so as I was saying, the way. We have the government way and we also have the private way. So with regards to government, we'll generally have either a clinic, a community health care center, a district hospital, or an academic hospital. So those are the four levels generally of service that you will receive in government. Generally at a clinic, clinics will usually be open from 8 to 5 or from 7 to 5, and those are your kind of day clinics, if I can put it that way. Whereas community healthcare centers are also basically like a clinic, but they're open 24/7 generally, and usually this is where you will find the maternity sections in the community healthcare center. It's also generally where you'll find a obstetrician or a gynae who is a resident there, for lack of a better word. And then you also have your district hospitals, which are generally in each district. You'll find there's a district hospital, and that's generally just for things where if you can either go to a clinic if a clinic is closer to you, or you can go to a district hospital if a district hospital is closer to you. Sometimes you do need to be referred by a doctor at the clinic to go to the district hospital. District hospital, the births there are kind of standard and not, there aren't issues there aren't issues that happen at a district hospital. Whereas when it comes to an academic hospital, that's generally not too far from a district hospital, but you'll also have to be referred to an academic hospital. And an academic hospital is generally connected to a university. So that's where you'll have your student doctors as well. And you'll also find that is also what they call a teaching hospital, where you will find that certain procedures that can't be done at a district hospital or at a clinic, or certain equipment that isn't available at a district hospital or at a clinic or community healthcare center, is available at an academic hospital. So this is the tertiary level of hospitals or care centers, medical care centers. So those are the four places where you can give birth when it comes to government. And when it comes to government, you don't need to have a medical aid. As long as you go there with your proof of address and your ID or passport, you should be able to be given care. No one should be turned away from a government facility. And then we have our private facilities. Now we have either the hospital route or the birthing center route, or we also have home births, but I'll speak about that a bit later. So with the hospital route, you have your 3 big hospitals as well as other smaller hospitals, but generally most of us know the big hospitals such as Life, the Life Hospital Group, Netcare, or Mediclinic. And those generally have, it depends where you go, but if you go to the hospital and you say, okay, I need to, give birth, then they'll be able to refer you to the right person. Generally, it's important to have medical aid in those instances, but you do find that some people have enough saved up to pay for that out of their pockets. However, it's not encouraged, because if you do, for example, if you decide to have a natural birth, that's going to be a lot cheaper than going the C-section route. But if you decide to have a natural birth and end up having complications and have to have an emergency C-section, then what ends up happening is you then run out of the funds that you had saved up, and then you might have to be moved to a facility, usually a government facility that you weren't really so keen on, So it's important to also just remember things like that for yourself. Remember the financial situation you are in, as well as the medical aid you are in. It's important also to do your research when it comes to medical aid. Make sure that the medical aid that you are under, that level that you are under, will cover the doctor's fees, will cover the actual stay at the hospital, will cover all the blood tests, etc. And if they don't, make sure that you make a plan beforehand, because the last thing you want is to be sitting at home with a newborn baby and bills just start landing on your doorstep. That's definitely not a situation you want to be in. So like I said, research is so important when it comes to birth. Okay, so we have the hospitals, private hospitals, and then we also have birthing centers. So generally what happens at a birthing center is you'll find that it is run by a midwife, and you'll find that other midwives will then be assigned to your birth. And generally what can happen is you can either have it's important actually to have a backup gynae or a backup obstetrician for your if you decide to go the midwife or birthing center route. And then for your normal checkups, your 8-week no, actually it's generally from 16 weeks onwards, every 4 weeks, and then from week 30 it has to be every 2 weeks. So those appointments you can do with a midwife. They're generally cheaper. I can speak about midwives and just go a bit more in depth in another video. Let me know in the comment section if you'd like that. Okay, so you can have, throughout your pregnancy journey, you can have a midwife who you develop a relationship with, and it's really beautiful. I went the midwife route, and it's really beautiful to see how they can really take on what you want for your birth. But obviously, like I said, it's important to do your own research and do what you are comfortable with. So there's no one-size-fits-all solution for this. Okay, so with birthing centers, you'll have either a private birthing center that is privately registered by a midwife, or you'll have a hospital-affiliated birthing center that is affiliated specifically to a certain hospital. So for example, a very popular one that people know is the Genesis hospital, well, Genesis Birth Center, which is affiliated to Life Hospital Group. So now the manager of that birthing center is Life Hospital, but they operate as an independent birth center with their own midwives or private midwives who would then they use the facility and they help you along on your journey. Another thing to remember for a birthing center is you'll generally have the midwife, and then another midwife will assist during the actual birth. Okay, so unlike a birthing center where you actually develop a relationship with your midwife, what might happen in a private hospital is that you arrive for your birth, and then whichever nurse or midwife is on duty is the one who will help you, and your OB will then be called towards the end of your labor to help you out with the last stage of labor. I'll also create another video speaking about the different stages of labor, so let me know, put a thumbs up, click the thumbs up button if you like this video, and I'll definitely know that you guys are interested in learning more about the different stages of labor. All right, and then the last thing we have is a home birth. So with a home births have kind of gained a lot of traction with COVID-19 because people realize that they would love to have their birthing companions, either their partners or their moms or their doulas, with them during birth. So home births have become quite a bit more popular, and what happens is you'll usually contact a private midwife and ask them if they can help you out at your home. They come, they scout the place, set up, see if they will be able to set up a birthing station for you when you are giving birth, and just kind of make sure that they will have everything available to them on the day that they'll have to come and give birth to you. It's also very important with a home birth to check how far you are from the nearest hospital, as well as making sure you have a backup gynae or OB at that close hospital in case anything goes wrong. But these are the kinds of things that your midwife will talk to you about. It's also important to make sure that your home isn't too far away from your midwife, because the last thing you want to do is give birth and then your midwife comes later. That isn't a train smash, it does happen, but it is encouraged for there to be a medical person available during your birth, because things can go wrong, and just to sometimes give you that reassurance. However, if you don't need the reassurance and you think, I can do this by myself, that's also totally okay. However, it's also important to remember that certain births can only be registered with the Department of Home Affairs if a medical person signs off on them, or if a medical person was actually available during the birth. So yeah, so that is our video today, the how and the where of giving birth. Please give this video a huge thumbs up if you like it, and please do subscribe. I will be bringing more mom content in terms of pregnancy content, as well as more kind of hypnobirthing content if you want to learn about prenatal classes or antenatal classes. And yeah, I'll be bringing a lot more content your way. Thank you so much for joining me on this video today. I hope you have a beautiful day further.